struggling with your mood, maybe feeling down and depressed, or you are struggling with brain fog and poor focus, low brain energy, you go to complete a task and you just can't keep your focus and concentration going long enough to get it done. And maybe you're finding your brain just fatigues really easily, then one area to explore is the idea of circulation to the brain, right? The idea that are we getting enough blood and thus oxygen, fluid, nutrients, lymph flow to the brain? And how is that impacting thus our brain function? And this, there's a way you can actually assess if potentially you have poor cerebral circulation. And one way to assess this is to think about, do you have cold hands and feet a lot of the time? So, if you're sitting at a desk or doing whatever you're doing, going about your day, and just notice, like, do you often feel like your hands and your feet are on the cold side, right? It may be really cold. And that can be a sign that, like, just in general, we have poor circulation. And think about it, our heart is pumping the blood through our body, and it has to work kind of hard to get that blood up there to the brain, right? It has to work against gravity in that case. And so, if blood isn't getting to our extremities, our hands and our feet, and we have cold fingers and toes, and you're struggling with that depression or brain fog or trouble focusing, that can be a sign of poor cerebral circulation. Now, why might we have poor circulation? There can be a number of reasons, and that's definitely something to explore. I want to share a few of them with you today, but I would be thinking about number one, do we have good thyroid function, right? If we don't have a good functioning thyroid, our thyroid is sluggish. That means that, our metabolism, our energy metabolism is slowed down, and even our ability, right, to control things like our adrenal function can be another reason. And often with poor adrenal function, many people experience low blood pressure. So think about it, right? There's that part of how our heart pumps the blood, the fluid, the nutrients through our body. And if we just don't have the blood pressure we need to do that job, then we're not going to be getting blood to the brain in an efficient way. So, adrenal function, thyroid function, and there are a number of things that can impact both of those, of course. Just nervous system function in general, of course, right? Our nervous system is what controls our blood pressure, our heart rate, all of these things that are thus going to control how well and efficiently our body can get blood to the brain. And again, this is going to impact how well we can get nutrients and oxygen and all of these things our brain needs to function efficiently. So, if we aren't getting adequate circulation to the brain, that again can show up as brain fog, difficulty focusing, maybe even depression, fatigue, especially brain based fatigue, where we struggle to get tasks done. And so if you're noticing any of that and you're noticing maybe cold hands and feet or just maybe cold in general, maybe you have low blood pressure, maybe you have dysautonomia, that can be related to that nervous system function as well. Then one thing you can do to really help to alleviate some of those brain-based symptoms is to focus on enhancing cerebral circulation. And I have a couple of tips I want to share with you on how to do that. So, one of the most obvious things is just to get moving, right? If we're sitting for a long time, then we're not really helping our body to get that circulation going, right? We know when we start moving, exercising, we can really get that heart pumping, and that's going to help push that blood and oxygen and fluid and nutrients to the brain, which we want to do. And this doesn't necessarily mean you have to go do a 30-minute workout or what have you, but just getting up and moving around. So if you sit at a desk a lot, get up and move around a little bit every every hour, maybe every half hour, just take a couple of laps. I used to do this a lot when I worked in an office. I would notice, I would start to feel cold as I was sitting at my desk for too long. So I just get up and walk around the building a few times, just to kind of get my circulation going. And it would help me to stay focused and really help with getting that blood to the brain that we need in order to use our brains efficiently. And when we aren't getting those nutrients to the brain, when we aren't getting that oxygen and fluid and lymph, then that's going to impact how well our brain can work. And so that's why it's so important to really focus on enhancing that cerebral circulation. There's one other tip I have for you, and that is to use what we call nootropics, right? We have some herbs that can actually enhance cerebral circulation, things like gotu kola and ginkgo, as well as bacopa, right? These are what we think of as nootropic herbs that help to enhance cerebral circulation, get blood to the brain, and also help to combat some of that inflammation that's almost always a part of the picture when we're struggling with our mood. So, using some of these herbs, especially in a formula, an herbal formula to help support brain function. I would use some adaptogens as well that can help with the adrenal function, maybe some nice warming adaptogens like American ginseng or Asian ginseng, depending on your situation, could be really nice here. Anything we can do, right, to enhance the ability of the brain to get blood and oxygen and nutrients and thus work better. It's going to impact your mood, your energy, and your ability to focus and get things done. So give that a try and notice how that shifts your energy and your brain function and even your mood. And I'll see you next time.